Okay, well, next I'm pleased to be able to introduce my colleague, Sarah Carr, who's a registered veterinary nurse. She's been qualified for 11 years. She's spent much of that time as a head nurse. She's been involved in nurse training. She has rescue and rehabilitation of penguins on her CV, which you may have noticed, which I'm sure has fed in at some level to this presentation. But she's going to talk now about perhaps taking some of that thinking very much into the consulting room and veterinary practice. So thank you, Sarah.
Thank you, Sean. Good afternoon, everyone. First of all, I would like to thank you for the invitation to speak to you all today. I'm the head nurse for the community and education team at PDSA. So, as Sean said, following 10 years in private practice and a period of travelling and working in New Zealand, I joined PDSA just over 2 years ago, and I can honestly say I've never looked back. I'm fortunate enough to work in a team that's dedicated to improving animal welfare, and I'd like to share some of our work with you today. So there's certainly no doubt that the UK is a nation of animal lovers, which would lead us to believe that all aspects of our pets' welfare needs are being met. But sadly, evidence does suggest otherwise. So in 2011, PDSA launched the first ever paw report. The Animal Welfare Act, as we know, introduced a duty of care for all pet owners to meet the welfare needs of their pets. There was no formalised way, however, of assessing and monitoring companion animal well-being at population level. The PDSA Animal Wellbeing Report was the first step towards this, and it's the largest survey of its kind. The paw report is based on the 5 welfare needs and allows us to survey pet owners on their knowledge of the 5 welfare needs in direct relation to their pet. The purpose of the report is to deliver an annual score reflecting pet well-being in the UK, which in turn gives us guidance as to which areas we need to target the most. Results from the previous 3 reports have demonstrated that, worryingly, owners are not sufficiently aware of the needs of their pets. The post-legislative assessment of the Animal Welfare Act 2006 in December 2010 also put an onus on all of us to improve awareness of the legislative requirements amongst pet owners, and this has led to the introduction of MOTs at PDSA. So as veterinary professionals, our consultations naturally gravitate towards pet health, but this, as we know, is only one of their 5 welfare needs. A lack of education and awareness of the basic health and welfare needs of our pets means that many pet owners can be misguided with their affection towards their companion animals. By informing and educating owners, we can help them to make positive change in their pets' lives. Specific clinics are often run into things like obesity, but helping owners realise the importance of their pets' 5 needs can be a challenge in consults. Pet wellbeing MOTs, developed by PDSA, are a novel way of prompting conversations with owners during a 15-minute consultation structured entirely around the 5 welfare needs. It allows us to focus on an aspect of pets' well-being that may not have been covered in a typical conversation. For example, a preventive health recommendation, advice on diet, living environment, or behaviour. Pet wellbeing MOTs can bring numerous benefits to clients, pets, and veterinary practices. So some of the benefits to owners will be that they gain clear, correct, and concise information. It allows owners to improve their pet's quality of life, and it does give a certain amount of client satisfaction. It does, of course, allow owners to discuss with a veterinary professional a topic they wouldn't usually have discussed in a normal consultation. Benefits to pets, which obviously is something we're very concerned with: improved physical health, improved mental well-being, and in turn, happier, healthier pets. And of course, benefits to the veterinary practice. It does bond clients to the practice. Veterinary professionals are trusted and they have direct access to pet owners. It helps staff focus advice on areas needing improvement, and there is a certain amount of income that can be generated from preventive procedures and products. So wellbeing MOTs are tailored to suit individual clients and animals, allowing specific recommendations to be made. It's not expected that all 5 welfare needs will be covered in a 15-minute consultation. It's unlikely that that gives us enough time, and that would, of course, overload the client with information. But it does allow us to have one extra conversation about an aspect of pet well-being and identify a need for any follow-up consultations. So we tend to advertise our pet well-being MOTs through waiting room displays and word-of-mouth recommendations by hospital staff. And also we target owners who've taken on a new pet and ask for a general health check. So which pets do we offer pet wellbeing MOTs to? Generally, we'd say any. We wouldn't target sick or injured animals, but we do aim to speak to new pets, so they may be rehomed, rescued, or in for first or second vaccinations. Boosters, neutron checks, flea and worm checks, weight checks, and those that are booked as a revisit from a normal consultation if a concern was identified. We use a number of resources in our pet wellbeing MOTs. To help structure the consultation, we have an MOT sheet. So this is really just a prompt sheet that we use, which gives us an idea of the sorts of questions we may want to ask the owner to gain an insight into the animal's overall welfare. As I mentioned previously, we wouldn't expect to necessarily get through all 5 welfare needs during this consultation, but we would aim to discuss an area of well-being that we wouldn't normally have had that chance to discuss. We use an owner booklet to jot down notes for the owner to take away with them. And in this booklet, we use a traffic light system. So we do MOTs and we use traffic lights, but we are still dealing with pets. So we use red, amber, and green. So they're scored red if we find that there's action required, so maybe the welfare needs of that pet in that particular area aren't being met. Amber means there's room for improvement, and green says that they're doing a great job. The graphic that you can see there in the booklet does explain the difference between red, amber, and green, and it gives the owner guidance on how to improve their pet's welfare. We'll always note down 3 top owner actions as well, and advise them of when we'd like to see them again. And finally, all clients go away with client education leaflets that will give them extra information on their pet's welfare needs, meaning our messages continue long after the consultation ends. So veterinary professionals are essential to client education and animal welfare. When preparing for pet wellbeing MOTs, we read the Journal of Small Animal Practice Quality of Life papers promoting discussions and decisions about dogs' quality of life, assessment of companion animal quality of life in veterinary practice and research, and preliminary evaluation of a quality of life screening programme for pet dogs, co-authored by David Main, and we took helpful pointers from them. We also worked with Rebecca Schofield, a veterinary nursing and practice management degree student, on her honours research project on the perception of the benefit of pet wellbeing clinics. This showed us that 93% of clients felt wellbeing MOTs were useful in getting them to think about their pet's quality of life. 97% felt that wellbeing MOTs would help them to improve their pet's quality of life overall. 75% of veterinary professionals felt that they were a useful tool for improving animal welfare, and 76% felt that clients did benefit from attending our MOTs. Clients have been shown to implement changes to their pet's lifestyle following a pet wellbeing MOT, and all clients surveyed believe that pet wellbeing MOTs should be offered by all veterinary practices across the UK. So we believe these consultations offer the ideal opportunity to consumerise the legislative framework and support owners with very simple actions. Our teams find them valuable, and based on feedback, we look forward to refining them further. The 2011 PAW report showed that only 45% of owners were familiar with the Animal Welfare Act. Worryingly, this decreased to 31% in 2012 and rose slightly to 38% in 2013. We feel that pet wellbeing MOTs could therefore help to increase overall public knowledge on animal welfare requirements. UK-wide, PDSA has found that 10 million pets are likely to be suffering from poor physical or mental health simply because their needs are not properly understood. Pets play a massive role in people's lives. They're more than just pets, they are a part of family life. We believe in changing owner behaviour through education. Until there is a deeper understanding of what pets need to live happy and healthy lives, improving pet well-being will continue to be a challenge. We all need to do something to help owners understand their duty of care. Unless people truly understand what they need to be doing and why, they will never change their behaviours, and as a profession, we will continue to treat preventable conditions. Our pet well-being MOTs are just one of the steps we're taking in trying to improve animal welfare. One day, through the help of initiatives like these, we hope to achieve our vision of a healthy life for all pets. Thank you.
Thanks very much, Sarah. That was brilliant. I should have said in the opening comments that Sarah's currently heading a team of community and education veterinary nurses who, as well as delivering many curriculum-linked school talks, are delivering these pet wellbeing consults, MOTs, at quite a rate of knots and refining them as they go along. So I'm sure she, hopefully, as well as everyone else, will benefit from any questions about them or comments. On there, please.
Hi, Sophie Beckwith, RVN in practice. Thanks, it was a great talk. I just wondered, is there anything in place currently to get veterinary practices to take on board wellbeing clinics as something they should be doing, not optional, but something mandatory for them?
Yeah, I mean, we are planning to, what we want to do in our hospitals is refine them so that our pet wellbeing MOTs are really working as well as they possibly can. And what we're looking to do in the future is then be able to work with yourselves to obviously offer them out to all veterinary practices. But yes, it's certainly something that I think there's a need for.
Hello, James Howie from Limpbells and a Vet in Practice. You talk about how owners are implementing the changes that you've talked through. Just wondering how you measure that implementation. Do you have follow-ups afterwards?
Yes, so in our hospitals, we do tend to have follow-up appointments, and obviously they can work as a normal consultation, so we may have revisits, whether it's a month down the line, 6 months down the line, so we do monitor them in our hospitals. We do something called the Pet Check Tour as well, which Sean mentioned briefly then, which I'm a part of. So on the Pet Check Tour, we have mobile veterinary vehicles that tour around the UK, and we've got 5 nurses, including myself, who work on this. So what we do is just solely offer these pet wellbeing MOTs. And what we tend to do in those areas is try and revisit the area 6 months after our first visit and invite sort of the same owners back so that we can assess and rescore them on our sort of matrix there and see how they've improved that pet's welfare. They also get sort of follow-up advice emails and things like that, so that if they've been scored, say, red for environment, they can go to a direct link which tells them why they've scored red and the sorts of things they can do to move that through to a green, hopefully, in the future.
One down at the front, please.
Hi there, Hannah, Nottingham Vet School. I was just wondering, going back to the lecture we had earlier about hoarding, whether you've used any of these MOTs as a kind of way to highlight welfare cases, and whether you think that would be a good way of kind of trying to refer and deal with these problems before they get any bigger.
Yes, definitely. I mean, certainly from our point of view, the whole point of these MOTs is to educate owners. So if they're not necessarily aware of potentially the behavioural impacts or the health impacts of having so many animals, then that's where we can get in and talk them through the requirements. As I said, we only tend to focus on really one of the welfare needs in one consultation. So if we identified that as a potential problem, that's something we could really focus our advice on and then follow up with after that consultation.
Chris? Just a Chris.
Chris Lawrence, AWF trustee. Great concept. Do you see extending this to doing something with people before they acquire the pet? Because this is a bit shutting the stable door.
Yes, absolutely. I mean, one of the things we do, we have a number of tools on our website on educating people on how to choose the right pet for their lifestyle, for what they can afford and things like that. So we do have other sort of initiatives that we run that try to help guide people into choosing the right pet in the first place. Another part of my team's work is to go out and educate in the community and give talks on what sort of pet is suitable for people's lifestyles as well.
You knew that I would want to say a few words, wouldn't you? John Tandy past everything. This is a very important aspect of our work, I think, and I've been pressing for improvements in the information given to our clients for many years. Some people in this room have got fed up with me keep mentioning this, but I think it's extremely important, and I think it could be one of the things I was just about to enter onto the form that we could discuss in some detail at next year's meeting. The sort of things that we did in our practice that worked very well indeed. We formed a group called the Friends of the Practice. I often say 12 disciples did a good job to have a group of friends going around there passing on information that we'd like to get out there. Open days in the practice, of course, and I could go on, but one of the things that we did do was to hire local halls and theatres, and we hired a Victorian theatre in our hometown that took, we filled it, 300 and odd people with a variety of speakers, and we gave some money to welfare charities that we took out of that. But I think it's extremely important. We should examine it in more close detail, and we could take a look at informing people, which we did on the purchase of animals, animal behaviour, obligations under the law, and so on. Very important, I think.
Yeah, absolutely.
Okay, so a few more hands up. And just thinking from the companion animal practitioners amongst you, whether there's any, I'd be interested in any comments on sort of appetite or feasibility, practicalities of introducing anything similar in your own practices. But yeah, up at the top, please.
Well, it wasn't specifically that. Sorry, Kendall Shepherd, veterinary behaviourist. But it's obviously something that should be rolled out into all practices. My question really was if any behavioural issues are identified in your MOTs, particularly of aggression, because I deal with almost exclusively now assessing dogs that have been seized or have been otherwise their owners charged under the Dangerous Dogs Act. A large proportion of those clients, if they go to vets at all, go to the PDSA. And so these dogs are ending up biting. So I was just wondering, do you refer those cases on, particularly of aggression, or do you deal with them in-house?
We are actually just starting to work now, as Sean will probably go into a little further, with APBC, so that we're obviously giving them the right kind of advice. It's not the sort of thing that we deal with solely in-house.
No, but it is very important to get the correct, obviously, if those issues are identified. Yeah, thank you.
Well, all I would add is just, aside from being an impartial and non-vested interest chair, just to mention that... yeah, as Sarah said, it becomes very difficult to start talking about, exactly as you're identifying, to talk about the 5 needs and then not do a decent job of dealing with behaviour problems, albeit that, like everyone, we have great pressures of time and resource, what have you. So we're forming this strategic link with the Association of Pet Behaviour Counsellors and are looking to do as best a possible job as we can. In the middle, please.
I was interested in your school talks and what age you target the children and what kind of content you speak to them about.
Primarily, we go to primary schools. We do offer talks in secondary schools as well. We do a lot of youth group work as well. But we tend to go into primary schools and run workshops to each class, so reception up to year 6. Tailored slightly differently, obviously, according to the age range, but we really talk about responsible pet ownership and the 5 welfare needs, so that by the end of the workshop with us, they really know what the 5 welfare needs are and they can just reel them off to us. We tend to use case studies to show examples of what can happen and what can go wrong if those welfare needs aren't met. met. And we've got some nice video footage and things like that. So keeps the children really entertained, but gives them a real take-home message as well. And then they do go away with little animal antics magazines as well, which will then further talk about the 5 welfare needs and why it's so important for them to give these to their pets.
One at the front, please.
Bradley Viner, a veterinary surgeon in practice and RCVS representative on the Ethics and Welfare Group. Thank you again for a really interesting talk. It's great. I think most veterinary practices do something along these lines, usually as part of the sort of initial puppy consults. A lot of practices have veterinary nurses that then carry on from what the vet does in the consulting room and tie them into the annual health checks as well. But I think the way that you've structured it in those documents is really nice, really useful. And I'm wondering that, for myself, I think it would be quite strange to put something that's heavily branded with the PDSA into my own practice. Whether the PDSA, if they're keen to roll it out, or maybe with the assistance of the Animal Welfare Foundation, you'd put it out as a template that practices could then adapt to their own particular requirements.
Yeah, absolutely. I mean, certainly, as I said, it's something we really want to refine in our own hospitals first to make sure they work and make sure they're working as well as they possibly can. We have already had discussions about moving forward into the future, into being able to roll this out to the veterinary profession. And as you say, it wouldn't be heavily branded with PDSA. It would be, maybe in conjunction with PDSA or something like that, but it wouldn't be branded with ourselves, because obviously it's something coming from your practice that you're advising your clients on.
Thanks, Sarah. I'm conscious that Sarah finished a few minutes, or the whole session finished a few minutes ahead of time, so she's put herself in the firing line for a disproportionate amount of time. So please ask, just in the final couple of minutes, questions of any of the three speakers. I don't know if, David, you want to comment at all on how this relates to your JSAP work at all?
I think it's brilliant. I think it's
so yeah, not just a seeker.
No, but do it in practice. But I want to tease the word education, because I see education of school children as very obvious and needed to be done. But I get uneasy about when we're starting to use the word educate on clients, because I feel that's coming over as a bit patronising. So I think there's a refining of language, perhaps, because at the end of the day, the clients are often trying to do the right thing. And so if you come along as a great I know type of thing, you can be a bit...
it's more about
top down
discussions, isn't it, rather than educating.
That's
right.
And
I think that's where Richard's question picked up on your presentation, sort of linking the two, wasn't it? How we influence and communicate appropriately. Bradley, did you have another question for David?
Yeah, me again, I'm afraid. I did want to ask David a question, actually, and we ran out of time. In fact, both the previous speakers, that if I interpret it rightly, the evidence that you presented suggests that the reflective skills that you were looking at didn't really develop through practice without them being developed as such. In other words, when you looked at practitioners, they were no more advanced than if they hadn't had the experience that they'd had to get to that stage. That's something that's quite relevant to Royal College, because we are very keen to develop our Cert AVP, our advanced practitioner level, and to make our A module, which is very much about developing the supportive skills, including reflective practice, which we believe are very important in terms of developing not just good client relations, but good clinical outcomes. And we are now meeting a lot of resistance from practitioners who are saying, this is fine for new graduates, but it's not for me. I'd welcome any comments on that. In other words, can you teach old vets new tricks?
Well, just the first thing to say is that the tool I presented, the AWARE, is about reflective skills and ethical awareness slightly obliquely to that. And the data I showed after that was about moral reasoning ability, which are related but not the same thing. I'd like to think you can teach old vets new tricks, but I think, I don't know, I mean, you perhaps comment as well, David, we haven't found up to now a huge appetite, thinking about giving ethics CPD, but I think that's perhaps because practising vets, although they might realise that they're finding things difficult, they don't really know what can be offered, and that they might feel that it's something you can just do innately or you can't do, and the idea of it being a skill that can be taught and practised like any other skill, like surgery, is not really, that message is not really getting out there.
And I think the other point about reflective learning is a generic skill, not just applies to ethics, applies to everything else. Yes. And of course, vet schools haven't, in the past, done a lot of that. You know, it's been a lot of knowledge learning and regurgitation. But increasingly, of course, vet schools are trying to do that reflective. But yeah, definitely, old dogs can learn reflection, can't they?
And moral reasoning.
We're here, we're all thinking, aren't we? We're all wrong. Yeah.
Okay, a couple more. Yes, please.
Philippa Turner, chaplain at the Royal Veterinary College. I just had a question following on from what you were saying about education maybe being a little bit condescending. The red, amber, green, might you... I'm just concerned perhaps that the red might send people away, perhaps feeling humiliated or I'm not sure what, but if they didn't return, that would defeat the purpose. So how do you counteract that?
To be honest, it's never something we've had a concern with. I think it's really about how the message is relayed to them on why they've scored red. It's not being condescending. It's not treating them as though they don't love their pets, because clearly they do. So it's just about talking around the issue and why they've done that, and always bringing a positive spin to it. So saying, you're doing this really great. Now, if we could just get you to do this and improve this a little bit, that would just bump you up to amber and things like that. Like I say, it's really about putting it across in a really nice, friendly manner so that they don't feel as though we're sort of criticising them, as it were. But I completely understand your point of view.
Linda Lausek, States of Jersey. I was interested in the teaching students about empathising with people and linking it back to what Keith Chandler was saying earlier about vets not perhaps always being very good at introducing clients or asserting to clients what they have to do to comply with law or some moral aspect of looking after animals. And is that something that you are going to take forward after the empathy bit? How do you then go on to emphasising the seriousness of some situations that people come across?
I mean, my only comment on that would be that using the friendly friendship analogy, when it's a difficult conversation with a client, a friend would be very honest and very clear. And they would say, there is a potential problem here. If somebody else sees that, they may think this, therefore you should protect yourselves. And you can talk as a friend would talk in that situations. And so honesty, integrity is where that would come out. You can, I think if you just apply that mindset and with honest, what a friend would say, you can convey the significance of the situation to the client.
And also, if you're trying to put across a sort of a perspective that you think there should be a certain outcome and you might want to sort of argue for that, then again, these ethical and moral reasoning skills are very important, because you can see here are the main reasons why I think this is what you should do. So you're kind of backing it up with argument rather than just a sort of, this is my opinion.
Well, that brings us to time. Thank you very much indeed. It felt like there was a lot of novelty and a real eye to the future in each of the presentations. So thank you very much indeed to Sarah Carr, David Main and Dorothy McKeegan.